Welcome to the Potter Blog site, December 10th, 2013. Chinese health authorities are slowly starting to leak out information that there is human-to-human transmission of the H7N9 virus occurring in Chinese hospitals. Here's a video. Pay close attention to what this individual says here.
The evidence is not clear. We cannot rule out the possibility that the father transmitted the virus to his son-in-law because they were not living together before the father caught bird flu. But after the father was sick, the son was looking after him.
Now notice what she said. The father-in-law was not living with the son-in-law, but the son-in-law moved into the hospital to take care of the father-in-law, and then he caught H7N9 bird flu. Likely hospital-acquired transmission of H7N9 bird flu. What we see coming out of China is the truth, the whole truth, and nothing but the truth seems to be a system foreign to the Chinese public health outlets, as we never get all three facets of the truth from them at the same time. It seems to us that the Chinese have been molding information releases possibly to control societal angst. The case of the Zhejiang cluster also seems to fit that disclosure pattern. Today, December 10th, is when they announced that it was a father and son-in-law who didn't cohabitate until after the father got sick. Well, on December 1st, we noted that there were discrepancies in this case and that there were possibly two H7N9 cases at the time. They'd only reported one, the father. On December 6th, the Chinese announced that there, that there was a second case and that he was a relative of the first case. At the time, the authorities played down the human-to-human transmission aspect and pointed towards the 6 chickens owned by the family. Now, that's a different story than what we find out today. Today we find out that the second H7N9 patient was the stepson of the first and didn't live with him, but rather only had direct contact with him in the hospital after he started looking after him in the hospital. Now, frankly, to us, it's not surprising that this would be another hospital-acquired case. We think this has also happened in Hong Kong. We suspect this because we've seen poor infection control procedures in several videos and pictures previously released by the media. Now, the Chinese seem to have a great reluctance to release any information pointing at human-to-human spread of H7N9. Now, hopefully, that means that the Chinese see the fear of H7N9 as being greater than the actual risk of the H7N9 virus itself. So hopefully that means that the Chinese have a good insight into this H7N9 virus, and the slow action they're playing with the truth is just to prevent population fear, and they're not actually that afraid of the H7N9 virus. Alternatively, this is unfortunately a very big alternative, it could mean the authorities fear the loss of control greater than the loss of life. Now, certainly that was the case in the early years of China when they disarmed and slaughtered more than 20 million of their own people. Now, hopefully this is not the case now, as that would not bode well for a global pandemic.